7 people with unbelievably rare diseases that left doctors speechless. Number 7. Antoine. Antoine, a resident of the USA, is a dwarf man who was born with a rare condition called osteogenesis imperfecta, commonly known as brittle bone disease. This genetic disorder has made his bones extremely fragile since birth. As a result, he has endured more than 600 fractures throughout his life and has faced numerous daily challenges. Although there is no cure for this condition, doctors recommend using a wheelchair to improve his quality of life and assist with mobility. Despite these difficulties, Antoine shares his experiences on social media to raise awareness and inspire others, proving that resilience can overcome even the toughest obstacles. Number 6. Stephanie. Stephanie is a remarkable young girl living with Duchenne muscular dystrophy, a rare condition that predominantly affects males. Diagnosed at just 3 years old, doctors once predicted she would not live past the age of 7. As she grew older, her muscles gradually weakened, and severe scoliosis caused her spine to curve into an S shape, placing immense pressure on her right lung. To address this, doctors implemented a remarkable solution using a device known as the Halo. This involved attaching 15 screws to her skull, which were connected to a circular metal band around her head in order to stretch her spine and slow the progression of scoliosis. With the support of her family, Stephanie continues to inspire other young people with disabilities as a content creator, reminding them that if they are having a bad day, it's just a bad day, not a bad life. Number 5. Safari Cadell. Safari Cadell was born with a small tumor that gradually spread throughout his body, eventually forming a large tumor in his chest. Over time, this tumor grew so large that it interfered with his ability to walk normally, and his spine began to bend under its weight. Additionally, the smaller tumors throughout his body caused him constant, unbearable pain, making it difficult for him to sleep properly. Growing up in a poor family, Safari never had the opportunity to receive medical care, which led to a further deterioration of his condition. Sadly, without proper treatment in time, he may lose his life soon. Number 4. Harun Ghattari. Harun Ghattari, from Nairobi, Kenya, has become known for having one of the world's largest claw-like hands due to a rare skeletal condition called Ollier's disease. Born with the disorder, Harun's bones have been affected by non-cancerous cartilage growths, which over time have resulted in abnormal growth of his hands and fingers, making everyday tasks challenging for him. Despite this adversity, Harun has not given up and is currently raising funds for his treatment. Number 3. Kirunga. Kirunga, a resident of a small village in Uganda, became physically disabled due to polio. He was born perfectly normal, but suddenly faced this severe physical challenge and lost the ability to walk. As a result, moving around became much more difficult for him, and now he uses his hands and knees for mobility. Despite his challenging physical condition, there is no effective treatment for the disease, so appropriate medical care for his mobility has been unavailable. However, with the help of a local community, he has received a new wheelchair, which has made his daily life somewhat easier. Number 2. Katie Renfro. Katie Renfro is a young girl from Florida living with a rare and undiagnosed condition. At birth, she was diagnosed with megalencephaly, a rare disease that causes abnormal brain growth, seizures, and challenges with walking and speaking. Over time, her symptoms became so rare that it became difficult for doctors to pinpoint the cause. Since childhood, Katie has undergone several surgeries, including brain surgeries and tissue reduction in her face, but none of them have proven successful. Despite living with this condition, Katie's family has provided her with a supportive and loving environment. Number 1. Jay. 5-year-old Jay from Vancouver, USA, was born with a rare condition called arrhythmia, which left his nose completely absent. This condition affects not only his sense of smell, but also his vision. Even in daily life, he faces challenges such as shortness of breath and potential feeding issues. Despite these physical adversities, Jay remains resilient and dreams of a healthy, bright future.